Hey there. This episode of Straight Talk with Tammy Consejo will cover signs when someone is severely depressed. This video could be useful in conjunction with our series about suicide, but it also can be useful in general just to learn about what to look for when somebody may be depressed. So we're talking about severe depression today. Here are some big signals. Somebody you know may suddenly have a lack of interest in things that they love, things that they enjoy doing. They may isolate themselves if they're usually out and about with people and doing things. So a change in behavior for sure, and what the person is finding interesting. Another one is low energy. Depression can really sap one's energy. Everything can be harder, and sometimes it feels kind of like slogging through molasses or quicksand. Folks with depression tend to either have trouble sleeping or they might oversleep. But the system of sleeping a good amount for a particular person gets all skewed and messed up, and it's really noticeable. Somebody that's severely depressed may give away things that are important. If something surprises you, like, why is that person giving away this special item, or why are they giving away so many things all of a sudden? That could be a clue. Sometimes excessive crying can show up, even if somebody cries sometimes, which is okay if any of us do that. It just catches your attention that it's more crying than seems normal for that person. It also can be an increase in anger symptoms or an increase in irritability. Somebody's patience just might not be the same when they're feeling depression. Ironically, sometimes folks suddenly appear much better and they appear happy. The reason that's a sign is sometimes when folks do make a final decision that they are going to take their life, it's such a relief that they're going to be out of pain soon that it helps them feel a little better. I want to talk about medication for depression. So there are antidepressants out there. A particular concern if a child or an adolescent or a young adult takes an antidepressant, they could have a reaction that is the opposite of what we're looking for. So it might actually increase the likelihood that they may try to take their life. And in general, and for any age, sometimes when somebody's depressed at a really deep level of depression, they don't have enough energy to either plan a suicide or to carry one out. But if an antidepressant starts to make them feel better and have a little more energy, that may be when they actually do carry out a suicide or an attempt. So whenever anyone of any age is starting an antidepressant or is adjusting the dosage, it's important that somebody who knows that person well and is around them a lot is keeping an eye out to see if anything unusual or concerning is happening. The last one is hard to even say. Sometimes there are no signs at all, and that's called masking, like putting a mask on. Sometimes a person just really somehow can manage to hide how serious their depression really is. So this can happen if somebody does take their life. Sometimes people are so shocked to say, I had no idea. They seemed fine. Or I never would have guessed this in a million years. There were no signs. This is a hard one to swallow. Because as there is in another video on this channel, sometimes we just don't know. And if somebody really does plan to carry out a suicide, if they're able to not let you know, that's how they're going to handle it. That's hard. So this is the end of this particular video. I encourage you to look at the other videos within this series around suicide, because there are lots of tips. What to do, who to contact, how to get the help, what to look for. It's all together in this series. So check them out. I'll talk to you soon.